You are suggesting, as part of your health and social care policy, that you want an extra £50 billion per year by 2030 to pay for it. What is it, and where will you get the money from?
Yes, so we need to defend our National Health Service. For 14 years, there's been massive austerity and underinvestment in the National Health Service, and we hear stories time and time again of patients in beds, of people not being able to get care, and certainly not being able to see a GP on the same day when they need it. And before that, from the Labour Party, we had private finance initiatives that have left a lot of those trusts and cares in massive, huge debt. So politicians need to be really honest with the public and say this isn't about moving small pots of money. Ultimately, we need this huge investment. Now, your question is totally fair. Where are we going to get that money from? Well, if we tax the wealthy, and I'm talking about multimillionaires and billionaires, just a modest 1% on assets of over £10 million or more, as well as bringing capital gains tax in line with income tax. At the moment, we're taxing unearned income less than we're taxing earned income, and that seems unfair. Taking all of these measures together raises about £40 to £60 billion a year that we could put straight back into our National Health Service for real hope and real change.
So you're putting taxes up, then?
Taxes on the super wealthy, and actually there's a group of patriotic millionaires.
What constitutes super wealthy?
So assets of over £10 million or more would be 1%. Assets of £1 billion or more would be over 2%. I think in most people's books, that would be super wealthy. And in fact, there's a group of patriotic millionaires who are saying, please tax us more, because actually our country and our society is better when it's an equal society. So this is about making sure people who need dignity and care at the most times of need are provided for by the state, by asking for a bit of redistribution from those who have done very, very well throughout the pandemic.
And what about those who aren't saying, please tax us more? Are you not worried that they may leave the country?
So when I've talked to people about capital flight, there certainly is a risk that some people may leave, but often it's overestimated. And actually, I think that's a misunderstanding of why people invest in this country or live in this country. They live in this country because family are here, culture is here, history is here. And actually, I think if people don't want to invest and they don't want to say we want to put money into education, policing, the health service, then actually I think we should challenge that, because we should be prouder as a country of the things we can stand for rather than just being a place people can hoard wealth.
I've thought of a fatal flaw in your plan.
Please go for it. I'm sure you'll let me know.
You haven't got any MPs.
Well, we've got one MP currently, although she's not an MP now.
Down.
That's right. And so this is a huge moment where I think, you know, even people who don't support the Green Party in the past look at Caroline Lucas and go, there's someone who speaks authentically, who challenges power and has some really, really interesting ideas. But for too long, we've just had one MP, despite the fact that in the past, 1 million people have voted for the Green Party. So what we're looking to do at this election in places like Bristol Central, North Herefordshire, Waveney Valley, and indeed in Brighton Pavilion, is to increase our MPs. The last local elections, we've over quadrupled our number of councillors. And so we've proved that even under first past the post, we can and do win. So every Green vote across the country is a vote for real hope, real change, and more Green MPs in Parliament who will push a government to be better and bolder.
Talk to me about your birth policy pledge. It's been deleted from your website. The incidence of medical intervention in childbirth has escalated in recent years, particularly the rate of caesarean sections, which are expensive and, when not medically required, we will work to reduce the number of interventions in childbirth and change the culture. Why have you deleted that?
So pregnancy can be really traumatic for people, and this is a really sensitive subject. The way Green Party policy is decided is every single member gets a vote at our national conference. That is then policy, and what happens then is it goes to a working group with our spokespeople. Now, our health spokesperson in the Green Party is actually a GP Pallavi, who's out today launching our health policy. Now, with that, what then goes in our manifesto is decided through a manifesto working group. I realise this is very processy, but ultimately this will not be in our manifesto, which we'll be launching next Wednesday. We're always looking at that short-term policy, which is for this Parliament right now, what we'll do with 4 MPs, but we're also, within our policy, trying to have those wider conversations around policy, both on healthcare, but obviously the climate crisis too, and mass inequality in our society. Those are the things that are direct.
So you changed your mind?
It's not that we changed our mind. Those are a broader suite of policies that are looking at those strategic visions. They get filtered down.
So you still think that?
Well, that needs to be brought by experts, not me speaking on TV, and ultimately those need to be health experts.
It was, I mean, it was on your website, so you must back it.
No, so it's not in our manifesto until it's in our manifesto, which will be getting launched next Wednesday, and I'd love to come back then and talk about the actual policies we have in our manifesto.
OK, it's great to see you.
Thanks so much for having me.
Thank you. Good luck on the campaign trail. Thank you.